The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super, Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving to special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, how are you? Hope you're all fine and having a great weekend. This is Dr. Lederman, and we're here in the Radiosurgery Hour to talk about news, patients, how to live longer, better, smarter, how to help yourself, your family, your loved ones, your friends live better. If you wish to call us, Noah and Ed are in the studio. They are fantastic, and they're running the studio. The number to call for a question or comment is 1-800-321-0710. 1-800-321-0710. We're in the WOR studios in the heart of New York City. We have lots of news tonight and lots of patients to discuss, so let's hit the books and call anytime you wish. The first patient, very interesting woman from Long Island. She came to me earlier in the year. She came with severe pain in her hip. She had surgery for sarcoma. Sarcoma is a kind of cancer of the connective tissue, like the muscles and the bones and other similar connective tissues. Not so common, but we see a lot because sarcomas are often not treated successfully elsewhere. So this woman came with severe pain about a year after having sarcoma surgery on her leg. When they did the surgery, the surgeon removed the cancer, but he left very close margins. That means where the cancer was and where he cut were too close. And if they leave cancer cells, it's just like cutting a loaf of bread. If you cut a loaf of bread and leave crumbs, it makes a mess. If you have cancer and cut through the cancer, it can spread the cancer. And that seems to be what happened in this wonderful woman. She presented on pain medicines, in a cane, barely walking, barely moving. Her life was pretty much destroyed by this pain. She had seen her doctors, her surgeons, her cancer doctors, her primary, and no one had an answer for her. One doctor told her to come back in 6 months, and she did. She waited 6 months, then waited months more, had a biopsy that wasn't successful elsewhere, came to us. We found a recurrence of the cancer in her hip. The cancer was growing so much in the hip, it was interfering with her walking, her movement, causing pain. We talked about all the options available for her. She chose our treatment, which is a non-invasive treatment, no cutting, no bleeding, no anesthesia, no hospital stay. We zero in and hit the cancer and leave the healthy tissues alone. She had 5 treatments. Each treatment's about 15 minutes. It's called stereotactic body radiosurgery. She got better with each treatment. I saw her now. Follow-up is about 6 months later. She walked in doing great. pain is gone. She's smiling. She's doing well. She's back to her old self. She can do Indian squats on the floor, which she couldn't do that before. She can walk, live her life, maintaining her weight, happy, with scans that show resolution of the cancer. So that's actually not an unusual story with our great success. We're not perfect, of course, but with our great success rates, most patients have good stories to hear and to tell their friends after they visited and are treated at our outpatient cancer treatment center at 1384 Broadway, 1384 Broadway. People ask, where is that? It's on the southeast corner of Broadway and 38th Street. We're a couple minutes from Times Square. We're a couple minutes from Macy's, in the midst of New York City. Most subways, buses, trains, PATH, Port Authority, Grand Central, Penn Station are all within minutes of our office. So we're super convenient, but more than that, I think we're often super. We take your calls, we take insurance, we take most insurances, Medicare, Medicaid. We don't have machines to take your calls, we have human beings. You don't have students or residents, you have doctors who you can call day or night if you need. So, of course, none of us want to be sick, but if you're sick, it might be the kind of place that you want to have a relationship with, and a doctor and a treatment, and especially if you can treat patients like this lady who had a metastatic sarcoma, unsuccessfully treated by many others, came to us, 5 treatments, 15 minutes each, now in remission, doing great, happy, pain-free. And we have another gentleman, actually from a similar neck of the woods, a man about 55 years old. He was diagnosed 6 months ago with small cell cancer of the prostate gland. The prostate gland everyone knows about. It's what a man has, located between the bladder and the rectum. This man had an unusual type of, or pathology of cancer. It's called small cell. He was biopsied. It was found to be metastatic to lymph nodes in the surrounding areas. He went to a very famous cancer treatment facility. He got chemo for 3 months. It didn't work. He got chemo, got 3 more months of chemo, 6 months of chemo. The cancer actually spread. The pain got so bad. The mass, I just said that the prostate's between the bladder and the rectum. Well, the mass was so big, he couldn't urinate without a catheter. The mass was so big, the doctors last Tuesday told him he needs a colostomy and planned the colostomy on Wednesday last week. Colostomy is when you open up the abdomen, pull out the intestines, so a person defecates, goes to the bathroom through a bag on their abdomen rather than through the usual way. He came to us as a last ditch last Tuesday. We talked about all the treatment options. We examined the situation. We got him staged up to know exactly where the cancer is. We told him that we think there are other options besides colostomy. He decided to cancel the surgery at the big cancer place, come with us. We changed his medicines. We treated him. By Thursday, he's feeling 90% better. Friday, I called him after his first treatment. Pain has pretty much gone away. Fantastic. When he came to us, he was in such pain. He was twitching and moving and squatting and standing and twisting. He couldn't stay in one position. There was nothing comfortable. And all of a sudden, the pain was gone. I saw him again this week for second treatment, which went well. Again, radiosurgery is innovative, non-invasive, well-tolerated, outpatient therapy. He had the second treatment. I saw him. He's comfortable. He's pretty much back to normal. I asked him how his bowel movements are. He said they're fine. So I went from being told he needs a colostomy at a big cancer place last week to coming with us on Tuesday, canceling the colostomy, having radiosurgery, pain is going away, moving his bowels, not needing that colostomy, and we hope to get him into remission. So we'll report more about this man with a small cell cancer of the prostate. Yes, often there are choices available. Even if the big doctors, the big cancer places tell you need something, you may want to get a second opinion. It may be worth your life or your quality of life. It may change your life. And why not? Spend an hour, sit down, go over all the details. We'll talk about all the options. You might learn things. You'll get copies of your reports, copies of your pictures. Most patients who come to us have never seen their reports and their images. Here we will routinely give patients their reports, their images, and you can go home and study yourself. We think that's the best way. That's why we say we're not only super convenient, I think we're pretty super. We also take most insurances, Medicare, Medicaid. It's a private cancer treatment center, Radiosurgery New York, in Manhattan at 1384 Broadway, where we work for you. Another good news report, in the same part of the body, in the pelvic area. This is a woman we treated 2 years ago for rectal cancer, came in this week in complete remission from rectal cancer. So good news. Sometimes people say, how can you be a cancer doctor? It must be so sad and so depressing. Well, what about these patients? The woman with sarcoma thought she had no hope, was terrible in pain, couldn't move, couldn't walk. We treated her back to normal. One man was going to have colostomy at a big cancer place. Gave him options. His pain went away. His bowels are going. The third patient treated for rectal cancer 2 years ago, in remission. So sometimes what you might think is sad and depressing is actually exhilarating to help another person in need. And that's what we do, is to help other people in need. I want to talk about a new scientific publication that just came out looking at PET scans in women with breast cancer, as reported in the Journal of Nuclear Medicine just this past week. Looked at women under the age of 40 who underwent PET scans. PET scans are an injection of radioactive sugar, goes throughout the body. Usually cancer cells pick up more of the sugar. The patient's then scanned. We find out where the cancer is. And often we can have a better idea of where the cancer is. For example, I've talked on this program before about lung cancer. About 35-40% of people do not need the surgery if only the PET scan or staging was done beforehand. So we often encourage people to find out where the cancer is before rather than after. And this study again confirms it. Published in the Journal of Nuclear Medicine, looked at women under the age of 40 with breast cancer. And in fact, these women, 21% of the time, were upstaged, where the other testing did not show where the cancer was. The PET scan showed. It didn't matter upon the race, the tumor type, the receptor type. No. PET scans had a better accuracy, would tell the women and their doctors where the cancer is, and you could often avoid unnecessary treatment, avoid unnecessary surgery, avoid even deforming surgery by knowing where the cancer is before, which is what we talk about routinely on the show. If we're going to go on a hike, it's better to have a map than to guess, and we like to know. That's the kind of philosophy that we share with you. We're going to stop for just a moment. This is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center in the heart of New York City at 1384 Broadway. We're a private center, which means we work for you, not the drug companies, not the surgeons, not others. We don't take money from any of those. Just we work for you. We accept insurances, most insurances, Medicare, Medicaid. We'll stop for just a moment, hear from these voices, and they'll be right back to take your questions. Call us if you wish at 1-800-321-0710, 1-800-321-0710.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation,